family, and friends. I am so excited to invite you all to listen to the first ever African American Child Care Provider Network in California being developed. What you're about to hear is our founder, our architects, and child care providers share stories about their experience through COVID, the continued struggles that African Americans are having with the racial inequities, and just their excitement about the African American Provider Network, what it's going to mean to African American child care providers, our children, and our communities. So I invite you to join us. Be part of the change that you want to see. This was created for us, by us, and I welcome you all to engage with us. I am Jackie Majors. I'm the proud CEO of Crystal Stairs. I am Jackie. I am a mother, a wife, a daughter, an auntie, and a friend. I am a Black girl who has faced the harsh realities of racial injustice. I'm gonna throw this one. I am born and raised Los Angeles girl. Kaiser Sunset. I am a woman who has struggled to meet the demands of raising a family while trying to uplift my career. And I am indeed an African American child care provider. So for those of you who don't know me, that's who I am. So let's talk to you about the African American Child Care Provider Network. And it's really the African American Provider Network because it's easier to roll off your tongue. But I'm going to say for the purposes of our event today, the Child Care Provider Network. Out of the dust of COVID, the tears of George Floyd, and the daily vulnerability of being a child care provider, the African American Provider Network was born. At an impromptu lunch on the patio of Crystal Stairs, we've been debating this, but I think it was June 25th. My provider architects on the phone will have to validate that. But we did an open invitation to Crystal Stairs child care providers to come and talk to us about the current challenges that they were experiencing. Because as a former child care provider, I'm not former, I still run 17 child care programs, right, Lashana? As a child care provider, I remind myself daily that I don't always know what you're going through today. And so as we advocate for you and try to make sure that the supports are in place for you, it's important for us to touch base sometimes and say, hey, this is what we think your challenges are, but confirm that and validate that for us. So we did a call out, and I would say maybe 10 providers showed up to engage in this conversation about the obstacles they were facing. What we learned that day would forever shape what the African American Provider Network would be. It really created the blueprint of a program that is designed to address what I would call the specific needs that African American child care providers are facing. The blueprint of our program is really designed to address a couple of different things. One, creating a safe space. Two, providing trusted resources for you as African American providers. And three, creating business development opportunities. But those are the three buckets that we're trying to create in terms of supporting the going forward. But you guys buckle down because we're about to go into a panel discussion and our special guest, Dr. Alice Walker Duff. For those of you who know her, she is the reason that I'm sitting in this chair. As she and Dr. Karen Hill Scott were the founders of Crystal Stairs. We are 43 years old this February. And so it's so exciting to have her back to speak to you guys. And Martha Williams, who is also just a longtime friend of the agency. Every time I call her, she shows up, but she worked directly with so many of our providers for so many years. I've been here for 13 years. Martha was just leaving as I got here. So those are your special guests. We're going to have panelists explain the African American Provider Network and then do a call to action. So Alice, I'm so happy to have you. I am looking forward to hearing all the wonderful things you have to say. Welcome, my friend.
Thank you. Thank you so much. It's a delight to be here. And thank you for all of your work and leadership leading Crystal Stairs into the next generation, to the future. You've just done a great job in developing and growing Crystal Stairs in very strategic ways. So thank you very much. And I am really delighted to be here. It is really hard to believe it's been 40 some years since we started Crystal Stairs. But being here at the beginning of this organization is really important and meaningful to me. And I am really delighted to be here for the beginning of the African American Provider Network. It means so much, really, because it is an extension of Crystal Stairs and is founded on it uses the same values that Crystal Stairs used in our development, really, that of excellence, relationships, integrity, and empowerment. And so it just means so much. And it also means a lot to be here during Black History Month, as we know, should be every month of the year, but it's this month. And so while there's always these public meetings of Black History Month means a lot to me personally as well. And I'm going to share a little bit about that with you, because I am the great-great-granddaughter of Amos Noah Freeman, and he was an engineer in the Underground Railroad. He helped people who escaped from slavery from Brooklyn, New York to Chatham, Canada. My mother would tell me of stories about that her grandmother and her grandmother told her about the strangers in the basement that she must never speak about publicly, because those people were the people hiding in their basement, waiting for the time that my great-great-great-grandfather could take them to safety away from the Fugitive Slave Act. And so I was always really proud of the risks that my family took in order to help our organization. I was impressed with the organization that they developed in very, very difficult times. And it all made me feel very, very special. And when I was a little kid, I thought that the Underground Railroad really was a railroad, just like in the Netflix series. And my mother would laugh at me and say, no, it was not it was not a real railroad. She would explain to me, and this is really the important part, that the Underground Railroad was a network of people who knew the way, and they were sharing their knowledge with people who desperately needed to know the way. And that's what they did with people who were just like them, but for the grace of God. African American childcare providers are very much like Underground Railroad engineers. You know the way, you have knowledge, and you are sharing it with people who need it. And especially in these days of COVID, you're risking your life and your family in order to help others. And I hope you really appreciate and feel very special and proud about that. I certainly feel proud about it. And I am really delighted that you are developing an organization that will help you extend, expand, and grow and make you all more powerful in the great work that you do. The concept of an African American provider network that is supported with trusted partners like Crystal Stairs and has someone like Holly Mitchell, Supervisor Holly Mitchell, having your back is just so meaningful and has such great potential. I'm sure that when Jackie says 20 years from now, we'll be sitting around, or maybe you'll be sitting around saying, wow, I didn't know that we could do so much, but you can do so much. And so you have my full support. I hope that everybody who can hear my voice, who can join the organization and be strong in the work of the organization. I certainly plan to give you all the support I can. And I now get a chance to turn it over to Martha Williams, who is the epitome of childcare quality and support.
Thank you very much. And it is really, truly, indeed a privilege to be. I always support Crystal Stairs ever since Crystal Stairs is the family. And I joined this family in 1985 in the resource and referral department. This way I met a lot of different providers. And visiting the facilities, I was to check their paperwork. One of the things I really wanted to see if they had a contract that they provided for their parents, or did they have brochures or flyers about their parents? But some did, and some had excellent, and some needed assistance. And through the provider workshops, we were able to help them to do that. The provider workshops were workshops where you would become valuable, get valuable information for the child care homes and the child care centers. Quality child care keeps children healthy, developmental skills for communicating with their peers and their families. That also helps them to exceed in school. Child care children who attend quality, and I said quality, high quality child care presents a greater opportunity in life. They exhibit better behavior than ones that do not have the opportunity. They develop greater problem-solving skills and coping skills, and they learn the people around them in their environment. Provider workshops was a place where providers could get together and talk about what was happening in their world. But I want to say this, it is always important to build a good relationship with the providers when you go to meet them. Thank you very much, and I'm really happy to have been there.
Good afternoon, everyone. Hi, my name is Tanya Burns. I am the program consultant / coordinator for the African American Provider Network. And prior to this most recent job role that I'm currently working in, I also worked at Crystal Stairs for many years. I was there when Martha was there, and I was there when Alice was there for a very brief period of time. And it's so glad to have them both here today. So what we're going to do right now is engage in a brief discussion with the architects, and Jackie introduced them earlier. From the moment that they met with Jackie, they have and they continue to be the advisors of the African American Provider Network, really highlighting the challenges and needs of providers and working in partnership with us. Moving forward, they'll also become, they are leaders of the African American Provider Network, working in collaborations with the entire Crystal Stairs team to create the structure, the format, and content of the network itself. So what I'm going to do now is just dive into the questions. And our first question will go to Betty Luckett. Good afternoon, Betty.
Good afternoon.
Hi, so please introduce yourself, and then I'll follow up with the question.
My name is Betty Luckett. I have been the owner of From the Heart Preschool located in Inglewood for 22 years.
Wow.
Prior to opening my center, I was an engineer for the city of Los Angeles. So I brought a unique perspective to preschool, opening the first STEAM preschool in 1999 for Inglewood and Los Angeles area children. And I thought it was very important to share that aspect of science, technology, engineering, arts, and math with our students. And I really got to implement what I thought was most important for our families and our children is learning critical thinking. Once you learn how to solve problems, you can go as far as you like. So I think that was very important.
Absolutely, that's an incredibly wonderful skill to have. And how many years, Betty, have you been in the field?
22 and 22 years with being a Crystal Stairs provider. Happy to say that Dr. Duff was very important in me joining Crystal Stairs, Martha Williams, and a host of other people at Crystal Stairs made sure my entry into the resource and referral agency was excellent, and I felt like I was supported. It was not a lot of providers at that time in 1999, so the support meant a tremendous amount to me.
Wonderful. So can you please share with us about, it's been a really challenging 2 years. And as a provider during COVID, how did that impact your business?
Tremendously. And I will say, as I'm sure many other providers felt, just devastated as our enrollment dwindled and trying to figure out where our funding was coming from, if it was coming, how to sustain your staff and maintain your bills that you were responsible for. And I think that was one of my lowest points in being a provider. It was extremely stressful. It was scary. Supplies were low. Masks we couldn't find all the time. Wipes, sanitizing solutions were not available. It was stressful. But during that time, we were called by the governor to stay open and be essential workers, which initially we were not called. They just called for us to stay open. So many of us did. We put our lives on the line, not knowing how COVID could affect us directly, how it could affect your staff, your family, that you could possibly bring COVID to. I felt we were asked to perform a tremendous task with minimal support. I think if the African American Provider Network would have been established, I think we could have shared more information, felt more support. I would have had more people to cry to during this period when I called my providers that I knew and have, sort of grown up in this industry with, when I called to say, I don't know how I'm gonna make it. What do we do? I'm stressed out. I don't want to bring COVID home to my mom, who is 80 years old. So you just were under, and I'm sure all of us felt it, a tremendous amount of stress. And I think one of our fellow providers put it as the world was in a crisis. How do we survive? But if we had had the African American Provider Network, I think it would have provided more support. We could have shared information about supplies and distributions. And as soon as Crystal Stairs as soon as they were able to get their bearings, they came with supplies, they came with masks, they came with wipes, they came with whatever we needed. They came with masks, they came with sanitizer, all these things we could not find. And I know many providers shared with other providers if they had more than what they needed. And I love that. I think Tanya Mohammed was one of those persons who said, hey, I have extra. Let me get these things to you, and I think we kind of created a small network amongst ourselves, but we didn't have the tools to provide outreach to all of us. I wish we could have all been together at that time and commiserated and learned how to network and share the resources we did have. But yes. I want to commend Crystal Stairs for stepping up, providing us support, answering some of the questions. I'm sure all of you guys were creating policies as there wasn't direction for childcare and what was okay and what wasn't okay. And I think we pieced together things from the CDC, from LA County, and tried to make it work best for us. But there was not a lot of support for us. So I want to say this gives us a great opportunity to provide support, to network, to let everybody know what's available, how we can work together to make a better environment for our communities. And I think that's very important. Thank you.
Thank you so much, Betty. And certainly that is definitely the aim of this network for bringing together African-American providers to be able to offer that support and share information and resources to each other. That is really the umbrella of what we expect this network to consist of. So thank you again. And so our next question is going to go to Frank Proctor. And so Frank, what I'd like for you to do is to introduce yourself, and if you could also share, following your introduction, what are the most important and immediate needs and takeaways for you as a provider during the time of COVID?
Wonderful. Thank you. My name is Frank Proctor. Before I begin, I don't know how I go behind Betty. She expressed everything that we were all feeling. But my name is Frank Proctor, and I'm the proud owner of A Bright Beginning. And we have 4 center-based facilities that we opened 20 plus years ago. And it has been an honor serving our children and our parents for all of these years. What I think I bring slightly different than the rest of the people that you're going to meet are architects, and is the ability to figure out how to own our facilities, how to build our facilities, and not be tied to paying rent when business opportunities will come to where you can own that facility. And that's critical, especially when times are hard and your landlord is demanding money and you don't have the children. So if you own your facility, then you can dictate and determine where you're going and what you're going to be. It's one of those things where we talk about wisdom and we talk about generational wealth. This becomes something that has to be done. We cannot just pay rent for the rest of our lives. And then once your life work is over, then you have nothing to stand for. So that's what I bring to the table. I've been a general contractor for 20 plus years, and I'm extremely good at finding ways for you to open and own your own facility. You need to own the dirt where your facility is located. The thing that was extremely difficult for us was exactly what Betty experienced, but we lost the ability for our parents to interact. The days where our parents would come in on Fridays and read to our children or interact on Monday morning, that had to stop. They had to stay at the door and just allow their children to walk in. Not being able to see a child smile because they had masks on. It was heartbreaking, but it was something that we had to adapt to. It was not normal, but we had to figure a way how to keep our children safe and also allow their parents to continue to work. Because if we closed up, then Costco closes. When Costco closes, then we have no groceries. And it would be a landslide of the entire LA County it would cease to function. So the experience of that was the hardest for me, not being able to see our children smile. A big thing was we have teachers that we're all aging, and they were scared to death to come to work, to come where they had loved to be every morning. It was more fun to be at the school than to go home. I had one of my teachers said, I can't wait to get to work because my husband gets on my nerves. So that part was just so different to where, what do I do? How do I keep my staff safe? I was running around trying to figure out what to do to keep our building sanitized. We can't buy any of the equipment because we weren't at that time considered essential workers. We were just there. So once we started to figure out how to survive, then here we are. But if we had a network to where you could call and say, hey, you know, I'm having trouble with my mortgage, I'm having trouble with my rent. What are you doing? What have you been able to do? Then we would, you know, that becomes more generational. And I'm just so happy and proud that Jackie would invite me to come, because there's very few men that are in childcare. So to be here in front of all you guys, it is wonderful. It is wonderful. So I do thank you, and I'm not going to hold you any longer than that, but I'm extremely good at construction and acquiring properties. So if you're looking to buy or looking to redo in any kind of way the facility that you have, this is what our network can bring to the table. Because the other ladies here, they have childcare down way past where I am. But together we can do a lot of things, and that's what I bring to the table. Thank you guys for allowing me to be here. Thank you.
Thank you so much, Frank. And you made two really good points. One being really focusing in on business development opportunities. And certainly I plan to talk about that following this panel presentation. And, you know, the very last point that you made just before you wrapped up was really about everyone having expertise in some area, yours being in construction and buildings. And so what we also hope to do is to capture the expertise of the entire network and utilize that expertise as peer-led trainings and coaching and support. And so that's also going to be part of this process. So again, thank you so much. And our last question goes to Tanya Mohammed. It's a name that I certainly won't forget. Hi, Tanya.
Hi, how are you?
Hi, so please introduce yourself to the audience, and then I'll ask you the last question.
My name is Tanya Mohammed. I have been a family daycare provider for over 30, it'll be 32 years in December. And I have been with Crystal Stairs the whole 32 years.
Wow. And so the question that I have for you is, tell us how the African American Provider Network, if this, you know, moving forward, how it will impact businesses and professional development that's needed by childcare providers.
You know, I will say that this is such an asset. It's not often that we have something that's just for us as a people.
Yes.
And being a daycare provider is very solitary for the most part. And so I started daycare at 23. If I had the AAPN at that time, all of the errors, the mistakes, the issues, the problems, the contracts, things that you need to have, you know, things that you need to know, all of those things could have been eliminated. And a lot of providers, you know, they say, oh, you're just babysitters. No, we're not. And the world knows that we're not. We are essential. We stayed open. We taking care of your children in our homes. My sister is a physician. She treats COVID patients at the hospital. Right. We were having COVID come into our facilities, in our homes, affecting our families. So with this here, you have a network of other providers that they're sharing the information. You're no longer by yourself, and you don't have to feel like you are. You are being heard. We're being heard, y'all. We're being heard. Our ideas are taken into consideration, and Crystal Stairs is making it happen. Let me say that they are making it happen. And I know that, and I'm gonna say this because I'm from Ohio, but I'm in, Cali. Stop the set tripping. There's no more set tripping. Okay. I'm gonna just keep it real. You can see a provider at the school and she don't want to speak to you because it's like competition. No, we're all gonna work together. This is going to bring us together as a people, as a community, and even in our profession. So this is nothing but the best. You're not going to get any better than this. So every African-American provider, Black provider needs to join this network and be a part of this because it costs you nothing to be a part of this.
Right. Thank you for lending your voices, as well as your guidance as advisors as we move forward in implementing the African American Provider Network. We so appreciate all of what you've contributed, and we look forward to our continued work together. What we've been doing over the past couple of months to build the African American Provider Network. And so our vision for this network is that we create a support infrastructure, one that is peer-led, and one that will help you to sustain and grow your businesses. And so I want to talk about the network of services that will be offered to childcare providers, and we've touched on some of this. So the network is really the umbrella under which all of the other services really do fall. This is going to be that safe space that we've talked about. This is going to be the place where you all feel comfortable talking about the issues that are specific to you. We also know that you're struggling sometimes in meeting the needs of the families that you work with. We're aware that in our communities, some of the families that we're serving, they're experiencing homelessness. They may be children and families that are being served by the child welfare system. There might be domestic violence. And sometimes you need some support to address your own mental and emotional health needs. And so we're also going to be offering trauma-informed care. This is going to be a place where you can have trainings and professional development, as well as technical assistance. Technical assistance will be provided within the network. It's always going to be our goal that you support each other first. And where we need to go outside of the network to bring you other additional resources, we're going to do that, including working in partnership with other organizations. We also want you to have fun. So this is also going to be a place where you come together and you have social events and you get to know each other better. So you're able to deepen that support that you offer each other. And then the last piece of this is that we're going to engage in a lot of recruitment activities. We really want to have a total of 300 providers by the end of the period, our initial funding period. And then we also want to bring individuals new to the field, to the early care and education field. And so the second bucket is really about trusted resources. What we're promoting here, making certain that you have individuals that are skilled, that are experienced. And so we'll be offering coaching and mentoring services, and they can be standalone services. They can also be services that are paired with additional supports that will be offered through the network. Whatever it is that you need to build your program, we're going to work with you within parameters, obviously, to provide you with those resources and services. And then the last bucket that we're going to really focus in on is really around business development. And we've created several different pathways to assist you with whatever your specific career goals may be. And that might be becoming a licensed childcare provider where you need some assistance with training or purchasing equipment. We also have access to provide you with quality supports where you may want to enhance your program, and that might be purchasing a new curriculum or understanding new ways of interacting with children and families. And then our third pathway consists of educational assistance. And this is really for those who want to earn more early childhood education units. And what we'd be able to offer are tuition and books, payment for tuition and books and things like that, and partnering with other organizations to help you with completing the college coursework. And regarding all of these services, we're going to be walking hand in hand with you. We're not going to just refer you to programs. What we're going to do is to help offer technical assistance and really connect you with the resources and services that you need through our customized program.
You know, I'm very excited about the African American Provider Network and working in support of this program. You know, somebody is sitting in shade today because somebody else planted a tree a long time ago. We're excited for you to join the African American Provider Network, helping us not only to plant those seeds for the next generation of providers that are coming up, but to also enjoy the shade in the form of best practices, information, community. We've talked a lot about, you know, all of this shared expertise or this collective expertise on this call here between the architects, between our future coaches and all those types of things. And we really want to share in that and make sure we have an environment and safe space to do all of those things in.
Of course, my name is Judith Tyrell, and I am the proud owner of My Nana's House Family Child Care. I've been serving the South Central Los Angeles area for the last 16 years. Crystal Stairs has been my guiding light from the very first day I got my license. And so being a part of everything, I have partnered with Crystal Stairs on many levels, such as working in partnership with Head Start, Quality Start. I've also done, I would say all of the trainings that they offer has been beneficial to me. Now, my passion in working with Crystal Stairs has always been with community voices. I enjoy the opportunity to be able to go out and advocate for our children, for our families, for us as providers, to make sure we have the things that we need, funding and everything else, in order to be able to do the job that we need to get done. After everything that you have heard and have seen this afternoon, I'm asking you to please, if you have not signed up for the African American Provider Network, please do so now. You don't want to miss out. You know, the opportunity to be here on the ground floor of what is built by us, for us, you can't beat this. So please, if you haven't done so, go in the chat, click the link and sign up right now. Thank you, and I'm just so glad that you all are here.
You guys got a call to action. Be part of this initiative. So much is coming out of this for you. Please make sure you bring a friend. We have got to reach out to our community. We got to go get them. So let's go get our folks and make sure they are part of this initiative. Child care providers deserve this. It is our time. Let's make it happen.